By Dental Delight.
If you've ever been around someone who grinds their teeth at night, then you know how annoying it is. But this problem can also be the root of really bad things like TMJ. That's painful. Dr. Belinda Marsaw and her sister, Dr. Cora Marsaw from Dental Delight, are here to teach us about this and share some preventative tips. So we have a friend with us, and we were going to name it Russell after my dear husband until I realized this is a real human skull, so that would be creepy, so we'll have to go with an old boyfriend's name.
That's not creepy at all.
Or Lisa, you want to name the human skull?
That can be pretty creepy too. So,
What do we? Why do we grind our teeth at night? And I say we because I do it. I just found out from my dentist a couple days ago. I found cracks, and they're like, "You grind?"
Yeah.
Why do we do it?
The most common cause for grinding is stress. Now, it could be caused by malalignment of your teeth, which means they're out of place. It could be caused by pain of from another origin, but also stress makes you not only grind at nighttime, but also in daytime.
In the day.
Yes, and that's a little bit more easy to control, daytime grinding, because you're aware and you know what to do. And you can do that, but you can't really control nighttime grinding nearly as much. So what we tend to do, and especially as a periodontist, we want to hold the teeth, the integrity of the teeth. So oftentimes the Dr. Cora and our group at Dental Delight will make our patients something called a night guard.
Night guard?
Yes. However, we can make day guards too. Things that guards that you can wear during the day so that they look good and they get the job done.
Let me be the Price is Right model here on this.
It's a little tight, and you want it to be tight so that it doesn't just come off in the night and gag the patient or gag you.
And it's comfortable. It's comfortable enough to fall asleep. And
It's comfortable, and that's one of the adjustments that you make, the fine-tune adjustments once you get it and you wear it maybe 24 hours or 48 hours, and then you come back in and you let the doctor adjust it so that it's comfortable, kind of like your heartbeat. You don't even want to know it's there. You just want it to be very, very comfortable.
Right, because I think it would keep me awake.
It would keep
I'd be
you
so
awake.
aware of it that I don't know if I'd ever fall asleep. Show us in our friend here that we'll call Stuart. Where does the grinding happen? What is TMJ?
Well, I'm going to let Dr. Cora talk to us about that because
you don't want to touch it, right?
Yeah, that's right. That's my skull, and it's human. So,
Well, as you look at your friend here, actually it's a combination of joints. It's the temporomandibular joint. So it comes from the temper to the mandible, and it's a joint created by those two bony areas.
You know what? I'm going to have to just be brave and help you out here.
yes,
we
I
can
want
help us out
them to
here.
see this
And
joint.
so,
Right there.
and so
This
what
area.
happens is
Here,
if
I'll
you
hold it
take
and you
if you
move
take
it.
your fingers and you put it below right in front of your ears, at the bottom of your ears, and open your jaw, you can feel that joint open and close, open and close. And so that's kind of where all of the motion is occurring. And it's because there's ligaments that attach the lower jaw to the head.
Okay.
And that's why that's what your lower jaw does, is it actually attaches to your head. The top jaw is a part of the head. Okay,
yeah,
you see that
Well,
movement?
sure, that makes
Right.
sense.
Okay, so when you're biting and you're grinding, you're creating extra pressure in that joint, and it causes it to become inflamed, and so that's the word temporomandibular joint disorder. And you can actually, just like with your knee joint or your elbow, you can cause that joint to swell, and then it becomes non-functional, or you can
Slips
tear
out
the
of
ligament.
place.
Yeah.
We are
and
almost-
so that's the pain.
We're almost out of time, but really quickly, how do you know that someone grinds at night? What's the evidence to you? And are you usually the one that tells them, or do they know they grind?
Usually they don't know it,
Right.
but you ask them and you see signs on their teeth. Maybe their teeth are really flat surface, and so you know that
Cracked?
there's something going on, cracks.
That's what I have.
And you
Even
can have-
broken.
Yeah, even small cracks. And so, yeah, if you look at this is a person who may grind, but you know, it's usually ask the patient. That's the first question, ask the patient. Patients really know what's going on with them. They may not understand it, but they know.
Thank you, ladies.
Yes.
To get more information, you can contact Dr. Belinda Marsaw and her associates at Dental Delight. The numbers you see there on the screen, or by logging on to dentaldelight.com, offices in Dallas and in Duncanville.